Attendance here at the A&E department in Salisbury has almost doubled in the last few months as patients struggle with seasonal viruses and staff prepare for a tidal wave of flu.
And what's your ETA? Yes, we've already seen patients in the corridors, having to, sleep patients in places we wouldn't normally want to.
Is your job getting harder?
All the time. You already know that the hospital's full before you even start your shift.
The NHS spends all year preparing for winter, but this one is different, with hospitals bracing for a so-called quademic of disease, with an expected rise of COVID on top of a rise in norovirus cases, respiratory syncytial virus and flu. The latest NHS England figures show that last week there was a daily average of 1,861 patients with flu in hospital. That's up from just over 1,000 a day the week before. And those in critical care beds for flu has gone up almost 50%. More than 15 million flu vaccinations have been delivered since September, but with 1 week left to book them, health bosses are urging those eligible to arrange appointments.
We're seeing a number of viruses coming together, and when that happens, that obviously increases the pressure that hospitals and primary care and other parts of the healthcare system feel. So that's why we're really suggesting everyone should try and get the vaccinations when they're offered to them.
One thing that every member of staff has told me at every level of this hospital is that these aren't just winter pressures. They are under pressure all year round, and it's only getting worse. Creating extra capacity is now the priority for many hospitals across England, with staff working hard to move patients and manage demand.
I mean, everything's not quick and easy, is it? So you just have to be patient.
Ready to go home?
I would love to go home.
NHS staff are resilient after a relentless few years, but even they are wondering how much more can the service take this winter. Sangeeta Lal, ITV News, Salisbury.